Right. Look, do
Yeah.
you want to get started?
Yeah, sounds good. Thanks,
Okay.
Madeline. So welcome everyone. Good morning. Welcome to our educational seminar series on parenting anxious children, useful skills for encouraging bravery. I'd like to introduce myself. My name is Dr. Luknu Tamatorn. I am a postdoctoral fellow at the Baker Center for Children and Families. I've received my training in anxiety, helping parents. Um, Help navigate anxiety with kids, also help parents deal with challenging behaviors that might come out of anxiety or from other causes. I received my training at an in intensive outpatient program at McLean as well. So had some training in anxiety. And Dr. Madeline.
Hi, everyone. I'm Dr. Madeline McGuire. I'm also a postdoctoral fellow at the Baker Center, the Center for Effective Therapy. It's nice to have you all join. I likewise work with a lot of families and youth with anxiety, from as little as 3 to as old as 22. So we see a lot of different kids at our clinic, and we're happy to answer questions at the end. Um, but yeah, I hope this is what you were expecting and what you came for. But we'll get started in just a moment.
That's great. Okay. So to preview what's going to happen today is we will provide you with some background information about anxiety, talk about the impacts of anxiety, which I hope many of you might resonate with your daily experiences with anxiety, and then hopefully to go over some tools for caregivers to help you navigate anxiety with your children. We'll save some time in the end for the Q&A as well. Okay, so just background information here about anxiety. According to the National Institute of Mental Health and the CDC, the prevalence rate for anxiety for kids and teens is around 10 to 20%. Most prevalent mental health condition here, anxiety is the most common mental health condition, followed by depression and behavioral challenges. And anxiety can include topics that are very specific, like, fear of the dark or fear of needles. And it can also include topics that are more global and more generalized, like perfectionism, worrying about social judgments. In any case, anxiety can be quite interfering with the child's, several life domains, like their social life or their academics. We also know that anxiety can persist over time if the child doesn't receive the appropriate support or treatment. And with that, we also know that children who need anxiety treatment, only fewer than 20% of them receive the care that they need. And so it's very important as us adults recognize what anxiety disorders might look like, how they might manifest in our kids, and seek out support from professionals. So kudos to all of you for being here today to learn more about anxiety. So while the prevalence rate is quite concerning, I would say, one silver lining I would offer here is that because of how common anxiety is in kids and adolescents, that means that we know quite a bit about it and we know about how to treat it and how to kind of yield the best outcomes for kids and teens. So next slide here. These are some common, typical age-appropriate fears. I want to set the stage for sharing with you that, what fears are common at what age, and then we'll kind of juxtapose that in the next slide on when to worry. Um, so fears can be kind of categorized according to developmental ages. In infancy, childhood, kind of toddler ages, we might see fears that have to do with like loud noises, strangers, separating from parents. Large objects can be quite frightening for children at this age. Then when we move into the preschool years, we might see a broader range of fears, especially around like imaginary characters or the unknown. Things like ghosts and monsters can be quite common. The dark, noises, sleeping alone, falling asleep alone without parents. Then in the preteen years, kind of elementary age, teenage years, we see more fears that are realistic fears, like getting hurt, getting injured, getting sick, school performance, topic of death and dying might come up in terms of fears and social judgments as well. So you see here that the different types of fears that are typical in childhood can be related to just like their cognitive development. And you see that the sequence here of fears are more concrete, right? Like the loud noises, the big objects, more immediate fears. And this can progress into more abstract fear, more future-oriented fears as well. So when would you start to worry about your child's worries? I usually will preface this by saying that fears or worries are very natural part of being a human. We all feel fear and stress and worries, feel nervous or anxious at times. And anxiety is a natural emotion, and it can even be enjoyable in some cases or helpful for many kids. So thinking about that thrill you feel before you go on a roller coaster ride, not for me, but many people feel that as very enjoyable, that thrill that comes from scary movies or stories, that jittery feeling that you might feel before starting a sports game, for example, can help prepare us for, the course of action, getting ready to play a sports game, for example. Um, and while kids of all ages, us adults too, can feel anxious and get anxious, kids with anxiety disorders do feel worry more intensely and more frequently. So in terms of the intensity of it is more. So you might also see that there are topics themselves of what the child worries about is beyond what's age appropriate as well. So for example, like an 8-year-old worrying intensely about their college careers or their jobs in the future. So that would be something notable. Worries can feel sticky. And this is how I actually describe worries to kids too. Like it feels sticky, doesn't it? It feels heavy. And sometimes kids can feel quite hooked to it. Um, One quick example that came to mind is, maybe a child worries about their minor mistake that they made like several years ago, but it's still sticky. It's still sticking in their head. So when do we know when anxiety starts to become a problem is when it gets in the way. What does that mean? It means that when anxiety gets in the way of kids enjoying their daily life, or they kind of go through about their day more fearful and more cautious. And we do see impacts of anxiety across, the life domains like home or school or extracurricular activities. You might see that kids start to, go to school, like get late to school because they worry so much in the morning. They avoid doing certain things as well. And we also know that anxiety can impact relationships within the family unit or with friends and peer relationships. And a lot of the times, parents might find themselves in a tough spot. Like, how do I help my child with anxiety here? We have things that we need to get done throughout the day. Anxiety is holding us back, so it can impact the family dynamic. So in sum, when you would start worry is when you notice the intensity of anxiety is beyond what you would expect, and when it starts to prevent your child from doing things that they enjoy, or they go through their days seeming very stressed. Um, so I'm gonna pass this next slide to Dr. Madeline.
Thanks, Lukno. So right here we have some examples of what anxiety could look like, an anxiety disorder, maybe just more normal, typical anxiety. So we have Zach here, age 12. He's scared of the dark, being age 6. He cries and stalls at bedtime. When sleeping, wants lights and TV left on. He checks doors and locks under the bed. He's frightened, calling out to parents. Nighttime battles with parents, sharing beds with siblings and parents, staying up late. He's tired the next day. He fears the dark even during the daytime. And he's really ashamed of that fear of the dark. He won't go on sleepovers or let his parents get sitters. And another example is Emily, who's age 6. She had a bad day at school. Her friend broke her favorite art project. She worried about the spelling quiz tomorrow. She's afraid that her mother won't let her watch her favorite show, Rugrats, after school. And she gets frightened when she watches scary movies on TV. So, like what Luknu was sharing, in an anxiety disorder is above and beyond that normal range of worry and fear. It's persistent. So, it's not just that occasional or situational worry that we might see Emily on the right, where she's worried about that quiz tomorrow, or the kind of the day ahead of her. Whereas with Zach, we really see that persistent and excessive um, anxiety over a significant period of time, not just a couple of weeks, actually maybe several months, or even in this case, several years. It's impacting his ability to be with his family, for his family to manage his at-home routine, his night routine. It's impacting his peer relationships. He's unable to go on sleepovers. And it's probably making it really hard at school if he's waking up really tired the next day, hard for him to focus. And so really kind of Zach is an example of what an anxiety disorder could look like. And we're also seeing a considerable amount of emotional discomfort and difficulty coping. He's crying, he's really ashamed, he's feeling really intense feelings. Whereas Emily, some of these fears are more typical for her age. They're more fleeting, they're occasional, they don't really interfere with her daily life. And so the nature of anxiety, where does this come from? So anxiety disorders tend to run in families, suggesting a genetic predisposition. For example, if parents have an anxiety disorder, a child is more likely to have an anxiety disorder. There are a number of neural structures and neurotransmitters that play a role in anxiety, but the amygdala plays a significant role in how we experience emotions. And an overactive amygdala that you might see in a kid with an anxiety is more likely to perceive neutral information as a threat, and that really leading to heightened response to stress. However, biology alone doesn't determine anxiety. Environmental factors also play a major role. So, certain responses or situations unintentionally strengthen anxious behavior over time. So, parents, teachers, siblings, or other adults may allow a child to avoid situations in order to reduce distress, and unintentionally teaching the child that avoiding anxiety producing situations is the best way to cope. And we'll talk about more about parenting styles and anxiety shortly. Specific vulnerabilities such as temperament can also contribute to anxiety. Kids with behaviorally inhibited temperaments that are more cautious, sensitive, fearful in new situations are more likely to develop anxiety disorders. Additionally, early experiences where a child might feel out of control, experience a high level of stress, can also contribute to anxiety. As I shared before, anxiety can be learned or reinforced by a child's environment. So, one thing to really focus on is how the parents may have an impact on that. So parents may model anxious behavior. For example, if a caregiver frequently expresses worry, a child might learn that the world is unsafe and anxiety is a normal response. This might look like frequently voicing fears, overreacting to minor setbacks, constantly discussing the worst case scenario. Additionally, if parents are avoiding certain places, people, or activities because of their own worries, children may learn that avoidance is the best way to deal with their fears. So really, that modeling of that anxious behavior or worry. Accommodation also plays a role. Accommodation refers to any actions you may be doing or even things you're deliberately not doing because of your child's anxiety. This could look like speaking for a child when in a social situation, answering questions related to a child's persistent worries, so providing that reassurance, and sleeping next to a child who fears being in bed alone. So accommodating is a really natural thing for parents to do when a child is in distress. Parents don't like to see their children in distress, so it makes a lot of sense that most parents accommodate. Parents accommodate because they're attentive parents. They have a hard time seeing their child suffer. Sometimes we also accommodate because we need to get on with our day and we know the accommodation will sort of solve that problem or get the kid moving. But when we accommodate, the child's distress immediately decreases because accommodation has taken away that stressor, and the child doesn't have to cope with the fear or feeling uncomfortable. The problem is that every time we accommodate, both the child and the parent become more and more convinced that the only way for the child to function is by being accommodated. So the next time a similar situation appears, the child is more likely to ask for that accommodation and the parent is more likely to provide it. And this leads to maintenance of symptoms over time and to even more severe symptoms. And so, although accommodation is usually well intentioned, by accommodating, we're actually depriving the child of opportunities to learn that they can cope with the distress. So, really important piece of anxiety treatment is working with parents, and we also do just parent led treatment as well. Passing it off to Lucknow now.
Thank you. So we provided you some information about anxiety and how it can show up in your family. And we're going to now go over tools for caregivers. So I want to preview that we'll talk about psychoeducation, kind of helping kids understand the nature of anxiety, help kids face their fears slowly and gradually, as well as helping kids cope with their anxious thoughts and then their tough feelings. So in psychoeducation, this is really with the purpose of helping kids realize or recognize that the discomfort that they're experiencing is anxiety, and so that once we identify it, then we can start to address it. So name it, and then we'll talk about what to do. So naming the worries can be, I want to say, uncomfortable at first, right? If it's kind of the first time you're talking about it, and you might even see a reaction that's a bit more resistant, a bit more avoidant whenever you bring up something that is a topic of anxiety, of worries or anxiety provoking. But we do know that this is something that kids can get used to as we talk about it. So we'll go over some direct and indirect ways that we can still teach kids how to identify their anxiety, patterns of what they worry about, and cope with their anxiety. And the first tool that we will offer here is psychoeducation, talking about anxiety with kids. So I normally will start with talking about fear or worries, like what it is, kind of naming it. Why do we have anxiety? And usually I would kind of rest on this is a gift. A fear is kind of a gift that we get passed down from our ancestors. This is something that kept them alive from, living in the wild. And this is a gift that we also received from them that keeps us alive. So kind of talking about the benefits of, fear, benefits of anxiety, and tying that to the fact that we actually don't want to get rid of it completely, right? Because being worrying about something can be helpful. For example, if you didn't worry about being run over by a car, for example, you might not look left and right and check if cars are coming, right? So our fear and our anxiety can be quite protective. Another thing that I usually say to kids and teens is anxiety is our brain's own mechanism of keeping us alive. It's a built-in alarm system. And this here, I might use the language of real alarm versus false alarm, like helping kids think through what might be real alarms in your life. Physical danger, psychological danger, being bullied by friends, right? Discrimination, things like that. Those are things that we do want to be fearful of, and you can help kids think through how to cope with those real alarm. But on the flip side of this, anxiety can also be kind of like a sensitive smoke alarm. It kind of sets itself off, and kids can kind of have this false alarm moment where, for example, if a friend ignores them when they said hi to this friend, this false alarm can go off to, oh, my friend hates me, right? Even though there might be many other explanations of what had happened. So, what we you will see in our recommendations here, this is kind of based on cognitive behavioral therapy. And in CBT, we do believe that everyone kind of has this three components that we are going through. And also in terms of anxiety, um, we are helping kids break down anxiety into three components. And these are three components that are interrelated as well. So what are your thoughts? Like, what do you think when you worry about, let's say, an example of giving a presentation? I worry that people will, get up and leave when in the middle of my presentation. Then you help them break down, what do you think do you do when you are afraid of, talking in front of people? I might actually avoid things. I might look down at my notes a lot. I might avoid eye contact. I might rush through my presentation. And then you help kids kind of break down the feelings. What do you feel in that moment, do you think? Um, Nervous, obviously, anxious, but you might also hear other emotions too, like anger or disappointment in how their bodies kind of deal with anxiety. So helping kids break down thoughts, actions, and feelings can be quite helpful. I also help kids think about, okay, 100% anxiety is very uncomfortable, and it might even lead you to avoid situations that are anxiety provoking. I will provide some psychoeducation around what happens when we do avoid situations, and that will be that we might feel better in the short run, that we avoid that immediate presentation tomorrow, let's say, but we might not get to learn that we can actually handle the fear in the long run. So inevitably, avoiding will teach kids that anxiety is right. Kids will learn to be more afraid, and there will be this sense that anxiety is, more having more control of our lives than we do. So that's the psychoeducation piece. Um, the next tool that I want to share is helping kids face their fears. And I want to preface by saying that, anxiety can feel so powerful, it can feel heavy, it can feel so interfering, and how do we help kids reduce the weight of anxiety, reduce its influence is by just quickly, I want to share with you externalizing anxiety. So this is a quick little exercise to kind of create some distance between your child and anxiety. So this is done, it's kind of a concrete tool, you draw it out, like what would your anxiety look like? Oh, okay, it has spikes, it looks kind of, funny or silly or looks scary. You might name it, help them name it. What is the name of your anxiety? And some kids might come up with silly names or names that are a bit scary, but not overly scary. They might think of their anxiety as a character as well. It might work better for teens to kind of, what is your, if you have to like think about a character, who would it be? Or simply, teens might just say, I just want to call my anxiety, and that's totally okay too. But this is an exercise to kind of take power away from anxiety a bit, creating some distance. Then through exposures or bravery practice, bravery challenges. This is really with the goal of gradually helping our kids face their fears. And first, I would kind of help them kind of set goals, understand their fear hierarchy, or what we call the bravery ladder. If you have to imagine, 10 out of 10 being super stressful situation, what is your 10 out of 10? Okay, maybe presenting in front of the school assembly is 10 out of 10. What about a 5? What about a 6? So you would kind of understand here what are we dealing with in terms of the gradient of anxiety. Then I usually give it an analogy. It can be many things here, but it's along the lines of when you want to train for a goal, right? Like let's say the Boston Marathon, which I am now late for, by the way. You would think about if that's your goal to present in front of the assembly, how can we get you there slowly and gradually? Maybe it's presenting in front of parents first or siblings, presenting something to an uncle, someone they're less familiar with, and then kind of work their way up to presenting in the classroom and then the assembly eventually. So we think of each bravery practice is exercising your muscle to face your fears and to learn a couple things, which I will share in a little bit, but emphasizing here the go start low and go slow. A lot of the times, if we go too quickly, our brain kind of kicks into like the emotion brain, and it's really hard to learn things when we are in the flight, fight, or freeze mode. So when thinking about bravery practices, we want to kind of target things that feel a little bit challenging, but not overly challenging for kids. So what do we learn from these bravery challenges is a couple things. One scenario could be that we're learning that things get easier when we do more of the facing our fears. Like it gets easier when I present in front of my parents or in front of my friends, and then eventually I work my way up to public speaking. The second thing is we might learn that our most worst case scenario out feared situation might not actually happen. People might not, get up and walk away during your presentation. Right. But also, it could be that if your fear situation happens, people do get up and leave during your presentation. We allow kids then to learn that they can handle that anxiety, that stress anyway, right? So they can learn both that things get easier, bad things might not happen, but if they do, they're stressed, they can handle that. Okay. And Madeline.
Thank you, Lucknow. So, talking a little bit more about how we're helping kids face their fears. So, one thing that's really important is really reframing everyday life challenges into exposure. So, a kid can start to generalize their successes. So, if anxiety is getting in the way of daily life, we can use this information to set up future exposures, to maybe even have an exposure in the moment. Anxiety is telling me to do this, so I'm going to push back and speak up in class when it's feeling really hard. Avoiding swooping in to rescue. So what we were talking about before about the impact of accommodation on anxiety, we actually have to let our child feel anxious and distressed in order for them to manage their anxiety. If we're always coming in to rescue them or not letting them experience it, they'll never have a way to learn that they can actually handle the anxiety on their own. So that's a really important piece for parents. And sometimes it's really finding ways for parents to manage their own distress when kids are doing exposures or being brave. Additionally, if an exposure feels too hard, we can modify the exposure by stepping back without backing down. For example, if the bravery practice for a teen is to have a 5 minute conversation with a peer, and that's feeling really hard. And maybe it's something they've done in the past, but that day it's just feeling really, really challenging to try. Maybe we can decrease the amount of time that the teen has to talk with a peer. Maybe the teen is preparing some questions to ask before in case they run out of things to talk about. Maybe we have a more familiar peer for the teen to talk to. That way, we're not letting anxiety win in those situations. We're allowing the child or the teen an opportunity to still push back against anxiety. So really important to modify exposures, but not just give them up entirely. Doing exposures is really incredibly hard work. It's pretty much the hardest thing we can ask kids to do. And these kids are being really, really brave when we're asking them to approach these tough situations. So parents really need to praise their child often for their brave behavior. Be like a cheerleader for your child. We really want to celebrate the effort over perfection. So really the efforts to approach that situation versus like getting all the way there in one try. We want to praise courage. So you were so brave to try that. Acknowledge their feelings. I know that was tough, but you didn't give up, and show progress. So remember when this was impossible, look at you now. You're going to the doctor without an issue. You can also help them by boosting motivation with rewards. So give them points for facing their fears and then letting them cash them in later for small prizes. That way we can really build up the child when they're doing this really incredibly challenging work. So in addition, while we're supporting kids during these bravery missions, we really want to think about how we can support a child. Parents who are faced with a child suffering from an anxiety disorder often find themselves between two seemingly opposite poles. On one hand, they may feel like the need to reassure their child and help them feel less anxious. That would be that protective response. On the other hand, parents might feel that by reassuring the child or accommodating the anxiety, they're not doing enough to promote that child's self-sufficiency or independence. So that would be that demanding response. So a demanding response could look like, it's not that frightening, I'm not afraid, so it's fine, don't be a wuss, you're acting like this for attention, it's not a big deal. Whereas a protective response might look like, she can't handle the stress, anxiety can hurt, damage, or traumatize my child. My job is to protect them from all of this. So really the best response from parents to a child's fear are those that combine an acceptance and legitimization of a child's fear with the belief that a child can withstand more anxiety that they have until now. So really an example of that might be, I know this is hard for you, but you'll learn to manage it. Or I know that was a really tough exposure and you did a really nice job doing it anyways. So really kind of acknowledging that the realness of what it's like to be brave in that moment and continuing to encourage them that they can do these hard things. Additionally, we might use some behavioral skills to beat anxiety, especially if anxiety is really high and it's hard for a child to even think about approaching an exposure. So belly breathing, also called diaphragmatic breathing, helps kids manage their anxiety by activating the body's relaxation response. When kids feel anxious, their breathing often becomes fast and shallow, which can make them feel even more nervous. Belly breathing really helps them slow down the breath, calm the nervous system, and helps them feel more in control. And you can teach this with a fun visual like a balloon belly, telling them to pretend their belly is a balloon. And as they breathe in, the balloon inflates. And as they breathe out, the balloon deflates. They can also use a stuffed animal, like in the picture, to do this, having the child lay down on their back, put the stuffed animal on their belly, and when they breathe in, they watch the animal rise, and as they breathe out, it lowers. Kids might also like other skills like progressive muscle relaxation or PMR or guided imagery to calm their bodies. So PMR is a technique that helps kids release anxiety by tensing and relaxing different muscle groups in their body, teaching them to recognize tension and learn how to let it go. So some fun imagery for maybe those younger kids includes like a lemon squeeze or pretending you're squeezing a lemon as hard as you can and now drop it. Or sandcastle toes. So dig your toes into the sand, scrunch them as hard as you can. Now let the waves wash them away. Really nice ways to get a child really kind of feeling this tension and release in their body. Guided imagery can be really helpful as well with anxiety by using imagination to help create a sense of calm, really engaging their senses. Not only does it encourage that relaxation, but it also helps kids get a mental break from their worries by shifting their focus. So, imagery can really be whatever the kid is interested in. Maybe it's a space adventure and they're floating in space. Maybe it's a secret garden or a magic beach. There's a lot of great resources online on YouTube if you just look for PMR or guided imagery. So, really finding something that the child likes is helpful here. Coping with emotions and thoughts. So, really modeling how you take care of your mind and body. So, kids are always watching the ways parents are behaving and interacting with the world. And modeling that healthy way of managing anxiety can teach kids skills for anxiety management and also normalizes the need to do so. If you're feeling anxious with your child, it could be useful for both of you to pause and engage with some relaxation skill. In this process, you can like calmly narrate what you're doing, explain why you're doing it and how you're doing it, and providing this narration of your feelings and what you do with them to make what you do in that case to make yourself feel better will help them do this process in the future. Seems like something that's a little bit more attainable if they've seen parents do it as well. Additionally, the way we speak to each other or to children can sometimes send intense messages, even if it isn't intended. Oh, I had the worst day at work. I was late. My boss was mad at me. I'm never going to get that promotion. Using that catastrophic language that makes the situation sound worse can create a spiral for a child. And it also makes them more likely to express their own distress in this way. Part of managing anxiety is being able to recognize whether this worry is truly something dangerous or if it's still stressful, but not as big of a deal. Oh, I had a bad day, but hopefully the next day will be better. If all worries are expressed catastrophically, then each encounter with stress or anxiety will feel like something so terrible that it can't be addressed. So we really want to be mindful in the way we speak because kids are listening to that. Another way to cope with anxiety is to challenge unhelpful thoughts. So, explaining to a child that we have these little voices in our heads, some thoughts are helpful, some are tricky thoughts that make us feel worse. You can use a metaphor like a thought detective, detective thinking, to show how we might investigate and challenge unhelpful thoughts. You can help your child identify unhelpful thoughts by noticing what thoughts come up when they're feeling anxious. It could be helpful to use a journal or a worry cloud to write down anxious thoughts and teach them to challenge these thoughts over time. You might ask questions like, is this 100% true? How much do I actually believe this thought? What's another way to look at this? Or what would I say to a friend who has had this thought as well? So really helping them reframe those anxious thoughts into more helpful thoughts. For example, if a kid or teen might have the worry of like, I'm going to fail this test. Another way of thinking of it could be, I'll do my best and I can handle whatever happens. Really helps to have a kid be able to check their thoughts and see if they're helping them in the moment. Lastly, it can also be helpful to have a cope ahead plan. So where kids and teens notice what might be triggering anxiety, so what's happening before, a plan to cope in that situation. So whether that's practicing exposures, using some cognitive coping, using some relaxation skills, and checking in to see how it worked. This can be helpful if you know a challenging event is coming up, like a school play or a school trip. Really making sure kids feel like they have the tools to manage those things beforehand so they don't have to respond reactively. So this concludes the end of our discussion. I hope these tools were helpful for you to think about how you might use them with your kid or teen, and how parents can really help kids and teens face their anxiety. We're now happy to answer any questions you might have. Obviously, we can answer any sort of general questions. If it's a more specific clinical question, that's something that we would have to, talk in an ad needed basis and really think about whether coming to our clinic would be helpful.
I have a question.
Yes, go ahead, Christine.
Is that okay? I didn't know chat or just ask. But so given that oftentimes anxiety disorders do run in families, and so that you're talking to, I'm a clinician and work in an outpatient clinic, dealing with parents and kids, do you have any suggestions on how to sort of frame that treatment model, just in terms of helping parents recognize, that this might be sort of the way they've just sort of gone about existing and haven't really identified it for themselves as an issue or as problematic. They've sort of come to just sort of deal with their own anxiety as sort of a baseline piece. But in terms of, do you have just any suggestions helping framing that for parents in terms who might be anxious themselves and might be suffering from their own anxiety, in terms of that, and how that system manifests in the family?
That's a great question. I to better understand what you're asking, it's around like working with parents and how you might promote them, like thinking about how their anxiety is impacting their child. Is that right?
Yes, that was much better and perfectly succinctly asked.
Yeah. I think we really focus on working with the kids and parents in our treatment. So sometimes a kid might be presenting with an anxiety disorder, and a parent might be not totally aware of the ways that they might be accommodating. So sometimes it could be going through a list of like, what are some things that you might be doing differently for a child because of their anxiety? Really like walking through the day. What does the morning routine look like? What about when they come back from school? What about at night? What are you might be doing differently for that child, because they're anxious and because you don't want them to feel that distress, or it's too hard to kind of have them always anxious about bedtime and you just want them to fall asleep, so you end up staying with them. So really like going through and really normalizing this is something that all parents do, not just anxious parents, and really getting a sense of what are the things that they might be doing differently, and how can we slowly, we're not going to do similar to the exposures we're having the child do. We're not going to have the parent all of a sudden rip all the rug from under them and really just say, we're not going to do any more accommodation, but how can we slowly and gradually remove some of these things to allow a child to kind of feeling anxiety or to promote that, like that brave practice.
Just following up on that, I might have missed, but did you say, do you do some of the work with the child and the parent together, like such as when you're, just teaching the basics between what's normal anxiety, what's excessive anxiety, starting to introduce skills? Do you do that with the parent and child together?
Yeah, that's a great question. Certainly, yeah. I think when we look at anxiety, we want to see, okay, how can we support the family unit, through the parents as well to support the child. And a lot of times we do have like the child version of psychoeducation about anxiety. We might have a different session with the parents to talk about anxiety and kind of what Madeline was talking about, how it looks like in the parenting context. I do a lot of sharing, the skills that we talk about, how you would break down the exposures with the parents as well, because we find that, when the parents can implement, the exposures, the skills, the grounding skills, we find that outcome is much better and kids heal more quickly when they're consistent practices of facing their fear. So parent is very essential in the work.
Thanks. Thank you.
Question, yeah.
There's also some questions in the chat too that we can start to answer. I see one about I'm assuming the relaxation skills, practicing those at baseline. Definitely we want to practice those things first when a child is calm so they know how to do them. It's really hard to access skills when a child is like dysregulated, trying it for the first time. So introducing it to a child when they're calm, when they're in a neutral mood, and being able to practice it over time so that when they're feeling really anxious, it's something that they might be more likely to be able to do, and scaffolding that maybe in the beginning with the child, helping them do it together.
Do you have any thoughts about, do you see school refusal in this category, or do you see that as a separate problem?
We definitely see school refusal, there can be a few components to why school refusal might be happening, but definitely anxiety can be a big component there. And so really understanding like what is the function of the behavior, why is the kid staying home or not wanting to go to school, and then if anxiety is involved, how are we going to build a fear ladder to slowly approach that? Maybe it's like driving by the school when school's not in session, or zooming in with teachers to get comfortable with the classroom teacher, building that kind of fear ladder of things that a child might do to get closer to getting back to school.
Thanks.
I'm seeing in the chat a question from Michelle about a 6-year-old child who has fears of ghosts, and how to kind of challenge that fear, that talk through the reality of the fact that we've never seen it. So what I'm hearing from that question, Michelle, is we're doing the cognitive piece, right? Of like logically, like, have you seen it? Things like that. And sometimes what you're writing here in the chat, it's very common for kids to not be ready to kind of look at the fear for what it is, kind of logically or rationally. And given the age, not uncommon that kids would have this response. One way I'm thinking about this particular challenge is, it's is the fear of ghosts sort of coming from, like, wanting to reassure the safety, like, I am safe here in the house and my parents are there to keep me safe and protect me. So sometimes when kids kind of have reactions to things that like monsters and ghosts and things like that, I kind of look at the underlying like experience a little bit of like, what is it that they're looking to gain from, or to get, reassurance from parents. And it's not uncommon that kids are not willing to engage in like the exploration of how real or factual this is. But I would kind of continue with like, what can we do then before you fall asleep to kind of help calm your body and your nervous system? So we might take more of like the relaxation route. We might also talk about, you went to, I'm just assuming that this might be related to nighttime sleep, but last night you went to bed all on your own and you were so brave for doing that, even though you feared something might pop out. And I'm so proud of you for doing that. So kind of inspiring confidence that they can do the things that the fear of ghosts get in the way for. And help them build that self-esteem that they can cope with the fear. So like relaxation is another one too that can be helpful before bedtime, for example. Madeline, anything you want to add to that? approach?
No, I think that sounds great, Lookdown. And I think, yeah, it is really common for kids to not really recognize that like their worries don't totally make sense, and that's okay too. We can still challenge them to face their fears in that moment. I got a message about resources or examples of IOP or 504 requests to support the child at school. If your child does have an anxiety disorder, I do think it is helpful to reach out to the school if you feel like it's impacting their school performance. And it really depends on the type of anxiety a child might be presenting with. If they have social anxiety, maybe it's going to be having like a lunch bunch group or some sort of like social group where they can start to make peer connections and put themselves in a position where they're using their voice more. Sometimes anxiety can also affect cognitive skills or executive functioning, so it can be harder to focus or concentrate or organize. So maybe there are some things that teachers could help with in breaking down assignments, having extra support with assignments, things like that might help with the executive functioning. I think really depends on like what the primary concern is, but it certainly schools can be helpful in helping a child be more successful and be able to practice these things at school.
Yeah. And I would add to Madeline with the school piece, if your child has an individual therapist and they're doing the exposures, it can also be helpful to have that consistency with like what's happening in therapy and how they can generalize those skills in the school setting as well. So kind of care coordination for a more wrapped around experience with fighting back against anxiety can be helpful. Helping kids break down, like Madeline said, assignments or helping kids practice exposures in the school, that can give that same sense of like mastery over anxiety. It's a great question about school.
Um, Hi, thank you for this presentation. I have a question around, so my child, how do we parse out or differentiate, or maybe it doesn't matter, with anxiety and like oppositional defiance? Because what we experience is when we're asked to do a thing, and the immediate response is no. And when you try to work with that, it just gets bigger. And so it's hard to know what's really going on with that.
Yeah,
I don't know if there's a question there or
yeah, no. That's a great question. Not uncommon for the profiles of kids and teens that we see here too. Um, my kind of question that popped in my head is this something that is like high on the fear hierarchy that you're asking them to do? And it may not be. Okay, I'm seeing a head shake.
it's anything really.
It's anything. Yeah.
Mm-hmm.
Yeah, that's we might kind of target it with a different route, would you say, Madeline? In talking about sticking with the expectations, kind of building like a system of consequences when when they're able to do the thing that you ask. We usually, with this kind of profile, start with like praising and catching kids be good. In this case, it might be catching kids doing what you tell them to do. So tons of praise for that, tons of flexibility for like going with mom asks, and kind of help build their muscle of complying with instructions, because kids have to listen to commands all day. That's another piece too, that with kids having to listen to commands and instructions all day at school and at home, I think it's something like kids might get up to 60 commands before they get out of the house to go to school. So if you think about that emotional cup, right, of being asked to do things by adults all day, another piece of sometimes in our treatment is to kind of increase that quality time, parent and child. So you can put in the deposits into their emotional bank, right? So that when they have to do what you ask them to do, they are more likely to do it because they've had a pretty full bank to start with.
Thank you.